Welcome, everyone. Welcome, Dr. Shabnam Daskar, our Director of Medical Education at Live Younger. Thank you for joining us today, Dr. Carr. And we're doing part 2 of healthy breasts, or breast health and protecting ourselves from breast cancer. We discussed this before, but just to summarize, all women are at higher risk for breast cancer than ever before. It doesn't matter your genetic risk, if you have anyone in your family with it, whether you have the BRCA gene or not, none of that counts as much as environmental and other factors that are causing this dramatic increase in breast cancer incidence. Very reassuring when you read conventional medical literature that more women are surviving breast cancer. They usually say, oh, it's because we do better screening and better follow-up and all of that sort of thing. And my point always to patients is, why should we not prevent it? We know, because we practice precision and preventive medicine, that there are so many things that we can do to prevent our risk for breast cancer and improve breast health. Now, last session, we talked about estrogen dominance, and we talked about toxins and how those cause increased estrogen dominance. So today I want to talk about, we talked about lowering the exposure, so that means lowering the body burden of toxins. Today I want to talk about some strategies to eliminate the estrogen dominance and help the body process out these endocrine disrupting chemicals and estrogen itself, which will bring us to supplements, which will bring us to some lifestyle things. We already covered alcohol as a no-no. We giggled and said, we'll be really good, like we were this week when we just had 1 5-ounce glass of wine each. Was nice, friendly relaxation time. So is the stress reduction better for us? Yes, it was. Are my breasts going to suffer from that 1 glass of wine? No, I don't think so when we do all of these other lifestyle things. So, Dr. Carr, one of the things about estrogen elimination very quickly is gut health. And we eliminate estrogen metabolites through our gut. Is there any really important factor for gut health that you want women to know?
One major thing is constipation. So sometimes we kind of ignore constipation as, oh, it's a gut problem. We don't associate that with estrogen metabolism and higher risk for breast cancer, because if our body's natural estrogen keeps going back into the circulation because of constipation, because there are these wonderful gut bacteria which help in processing the estrogens well. And again, I know many of you want to do a gut test and figure out if you have those bacteria. No, we are not there yet. But if you have constipation, then that needs to be addressed so that the same estrogen, so same estrogen levels in the body, check in the blood. If you have constipation, they keep going recirculating back into your body. So even if you test for estrogens in the blood, you're not going to find high levels and decide, okay, my risk for breast cancer is high because my estrogens are high. And again, another important thing, Natasha, I wanted to mention is we talk about estrogen as if it's like a single thing. It's 3 different hormones, actually. And E1 is the estrone is the estrogen, which is called a potential carcinogen, meaning it can cause cancer. And after menopause, that is the predominant estrogen because a lot of it is made in the fat cells. E2 is the wonderful estrogen with 400 different functions in the body. And E3 is a mild estrogen, estriol, which is the predominant estrogen of pregnancy. So when we talk about estrogen, we actually mean estrogens, and depending on our age and all the different things that are going on, which estrogen is the predominant one. So after menopause, it is E1, which is mostly produced in the body. And it's equally important to be metabolized appropriately. And Natasha, last time we talked about estrogen metabolism.
Yes, so the metabolites of estrogen are eliminated through your poop. And you have to poop not just once a day, but 2 to 3 times a day. 3 is ideal. Most of your eyes are going like this. Oh my God. But truly for for your health and gut function, you need to have 3 bowel movements a day. A lot of people say, but I don't eat enough. Well, remember that more than half your poop is dead bacteria. And so if you don't have a healthy microbiome, that's why you don't have healthy poops. You know, we teach you about magnesium, we teach you about thyroid and vitamin C and how they affect your gut function and your pooping. But I really want you to remember that part, that it's the microbiome that helps you have healthy poops. The bacteria die and they live and they grow, and there's a whole cycle that they have of life of their own. And when you have adequate bacteria, you will poop. So taking probiotics and not eating yogurt for them, but taking medical grade probiotics, rotating them, increasing the amount of bacteria in your gut is usually something we start with quite early. And that's one of the most important supplements we recommend. I know you have your favorite top 5, which we're not going to cover all 5 here, but for relevance to gut health, estrogen metabolism, and estrogen balance, bringing the estrogen levels down, we need to repopulate the gut. If you've ever had antibiotics, if you had antibiotics as a child, it can still affect your microbiome today. Travel can affect your microbiome, airplane travel. There's so many things outside of antibiotics that affect your microbiome. Also, you know, all the things like stress, changing your diet, eating junk food, all of these things affected. So supplement number 1, well, not in order of preference or hierarchy, but would be a good quality pharmaceutical grade probiotic. Most people say, oh, I forget my probiotics. I really can't remember if it's in the fridge. Okay, great. Then buy a shelf-stable one, which most pharmaceutical grade companies provide shelf-stable probiotics. So Dr. Carr, the next one is diindolyl methane, or DIM. I'm very fond of prescribing that for every woman that comes in to the clinic. What do you think people should know about DIM and breast health, and why we recommend it so often?
So in lab studies, these supplements have shown benefits in preventing breast cancer cells from metastasizing, so from spreading, basically. Now, one thing we have to remember is when it comes to supplements, though we would love to have, what the standard, high quality studies, that doesn't always work because no one really wants to invest money into supplements because they
Right.
can be patented and all those things. So yes, diindolylmethane methane is one of them. And I know you have another favorite, Natasha.
Well, vitamin D is something we make sure every single person, if you live in Canada, you should be taking vitamin D. And the studies are so overwhelming with vitamin D for immune system function. I
Yeah.
mean, we know we have studies in rheumatology, we have studies in almost every cardiovascular health, bone health, we've always known. And it's just quite a standard recommendation. So vitamin D for overall health, for depression, anxiety, brain health, and every other thing in between. In fact, vitamin D is so important, it's called a prohormone, right?
Mhm.
And so is there anything I've missed in talking about vitamin D and why we think everyone should be on?
Vitamin D is extremely important for the immune system. And as all of you, both of you, y'all have heard Dr. Iyer and me talk about immune system all the time, because every disease is an immune system problem. Whether we're talking about cancer, which is of course an immune system problem, because not everyone develops cancer. So when our immune system is not able to kill those cancer cells in the body, that is when the cancer shows up. Otherwise, we have cancer cells in the body, but when our immune system works very well, we don't have that problem. And vitamin D is a major factor. And Natasha, you said everyone in Canada. I am originally from India. None of my patients had normal vitamin D because we are not out in the sun, and given our skin color will. So everyone all over the world, actually, that's my opinion, needs vitamin D supplements. And the other thing is, a few years ago, there was a very interesting paper which found that women who had higher levels of vitamin D had better breast cancer prognosis. That means they survived longer. And funnily, the title of that paper was Surprise Finding. And we are not really surprised because vitamin D is so important for the immune system.
And that's the difference between traditional medical models and precision and prevention, right? So my next supplement is called calcium D-glucarate. And that one is you don't put every single person on it, but if they have estrogen dominance, calcium D-glucarate is something that has been shown to help the elimination of estrogen from the gut. And you know, we know that nothing works in isolation, right? I did want to mention as an aside that after my mom had her breast cancer and her sister had already had breast cancer prior to that, you know, of course, I was obsessed about my breast health, and I started making these green smoothies every morning. And I had the optimizer in there because that helps liver health and remove toxins. But I started putting in kale every day, because I mean, you can't put broccoli and other things into your, well, I suppose you could, but it wouldn't taste.
I'll talk something about that as well. Yeah, go ahead.
Yeah.
Your
So I
kale
was
smoothie.
putting kale because it's a cruciferous vegetable. It's supposed to increase my sulforaphanes or my glucorophanins and protect my breast and all of that. And, you know, after some time, I really like, and I didn't put two and two together very quickly. I started to get a lot of bloating, a lot of gut issues and things like that. And then finally, at the time, you know, my husband said, I think it's the smoothies making us like this because I'm like that too. And turns out that after I spoke to Michal, it was that we were having too many greens every day of the same kind and actually upsetting our gut health. And so, you know, you can have the discussion about oxalates and all these other things that raw food has a place, like salads and things, but for the most part, you shouldn't be eating the same thing every day, is my point, in your quest to be healthy. But here I was trying to be healthier and do all these things. And, you know, it was supposed to give me more fiber and more nutrients.
We live and learn, Tasha.
That's right. But you know, the other thing I've been reading a lot is that kale concentrates thallium from the soil, and thallium as a heavy metal impacts your health if it accumulates. So if you're a poor methylator and a poor detoxifier, you will accumulate these toxins more easily. And phthalate, being a heavy metal, suppresses the immune system. So, you know, at the same time, we're all trying to be healthy, but then there's so many details, which is why we have Michal on our team, right? To educate us on our healthy behaviors becoming unhealthy for us.
So yeah, and Natasha, you brought up something very important about smoothies. So very often this is a recommendation from a lot of people that, okay, if broccoli is supposed to be good for your health, you should just eat broccoli and you don't need supplementation. Now here is where there is a big difference. And this is again based on studies. So this was many years ago in the 90s. Dr. Paul Talalay at Johns Hopkins had done this study, and he has a patent on, I think, broccoli sprouts. So basically, he is not, I mean, he's a very highly respected academic. And what he did was he took a bunch of broccoli from different stores. External appearance, all of them looked exactly as broccoli does. But what he found is when he analyzed all the different glucorophanins, and I can't even pronounce some of them, you know, myrosinase enzyme and stuff like that. Anyway, we are supposed to chew that and then the beneficial stuff comes out. What he found is in broccoli that looked exactly alike, different player markets, different stores, the amount of the beneficial stuff, the sulforaphane and all that, was very different. So if you just look at a broccoli, number one, there's no way to know whether, you know, how much of what it contains. Number two, and there are so many factors because broccoli might have traveled a long way. It's not something you just grew in your garden. The other thing is the concentration, like how much of broccoli are you going to eat in a
Well,
day?
that's a good point, because I had a patient say, I don't want to take supplements. I just want to get everything from my food. So I said,
Good luck.
okay. No, I said, okay. So let's pull up Google and see how much of each thing is
Yeah.
in there. And she had to eat 8 to 12 cups of broccoli a day to get
Every day,
every
Natasha.
day to get any reasonable benefit. But, I don't mean to pick on patients who have that goal, but you and I both know you can't get everything you need from food. I don't care what people say.
Yeah.
I absolutely take supplements every day. And here's a really interesting thing. So this is our healthy hormone metabolism, and it's got the diindolyl methane, DIM, at 150 milligrams. And I had a patient, I made a little video, it's on our clinic page, and it says, she came in, and I had to repeat what she said. So she says, I've been taking, and she plonks her supplement bottle down and says, I've been taking this for 20 or 30 years or whatever, right? Because she's in her 70s, for my breast health. And this one of yours is, I think, $20 extra. Or hers was 20, and whatever the case may be, I've captured it on video. And so I said, oh, well, that's very interesting. And then I took her bottle and I looked at it, and she's got 25 milligrams of DIM per capsule. So how many capsules do you need? 6 of those for this. So I said to her, I said, okay, so multiply your cost by 6.
Yeah.
And then you'll see how cheap this is compared, because this is the pharmaceutical grade, and all the studies, I mean, yeah, sure, there are lab studies and there are different retrospective studies and things like that, but we've sort of come up with how much of each thing you need to do the work that of protecting your breast health. So 1 a day versus 6 a day. And so then the math changes very quickly. So, without much further ado, I want to talk about melatonin. My son, when he was maybe 4-ish, very cute video we made for our Facebook followers at the time. And it was about melatonin and the immune system, because remember, we had just started focusing on melatonin supplementation and testing levels, and talking to patients about making sure they have enough melatonin for immune system health, breast cancer risk reduction, and by proxy, it becomes prostate health as well, because everything that affects breasts affects prostates in exactly the same way. So if your risk for breast cancer is high in your family and you're a man, sure, you could get breast cancer, but your risk for prostate cancer is elevated as well. So melatonin, what can you tell us about that, Dr. Carr, please?
So number one is, I think, Natasha, we have to differentiate very clearly between supplements and herbals. So supplements are things that our body is either supposed to get from food or through our natural processes. So things like melatonin, magnesium, vitamin D, these are things we are supposed to get naturally, versus other things like DIM and all those. So those are, so supplements are things we're supposed to get naturally. So when it comes to melatonin, what happens is, this is something very important to remember, because people think melatonin is a sleeping pill, you know. So it's not a sleeping pill, number one. Yes, it does help some people with sleep, but melatonin is a very powerful antioxidant. And as all of you know, if you're listening to us, antioxidants are very important to keep our immune system working well and keep us safe. Now, we are naturally supposed to produce melatonin in our body, and that's again related to our body's biological circadian rhythm. We wake up in the morning, eyes get exposed to daylight, and then the ambient light is supposed to fall towards the evening when the sun sets. But nowadays, what happens is, all of us are exposed to a lot of ambient light, and things like, these backlit screens can also reduce our levels of melatonin. Age can reduce our levels of melatonin. So a whole bunch of stuff can reduce our levels of melatonin. And we can measure melatonin, though we don't usually do, because it's quite irksome if you have to spit into a tube in the middle of the night and you can't have any lights. Even a little bit of light can kind of change your... I have never done that. I don't think I want to do that either. So melatonin, some people will say, oh, melatonin did not help me sleep. No, it doesn't work for everyone the same way, but it's safe to try and see whether it helps you. And sleep and melatonin and circadian disruption. So one of the potential carcinogens for breast cancer risk is supposed to be shift work, because what happens when people are, their sleep cycle changes completely because they're working at night. So light at night is another major factor. So sleep is again extremely important, not just for our brain function and mood, and also for our immune system. So when we are sleep deprived, our immune system does not function as well. So immune system is like so important, and there are so many things we do that kind of, changes how our immune system works.
And there's no overdosing with melatonin. I remember
We
years
feel
ago, I was
sleepy.
in the emergency department and a child came in, 16-year-old boy with an overdose, and it was melatonin. He had
Mhm.
taken the whole bottle of melatonin. And, we kept him, called poison control. This was when I was not into functional medicine or anything. I didn't even know really what melatonin was.
Yeah.
I should have learned about it in med school. Probably like one line
I
came.
I didn't learn, I had no idea about melatonin at all. We were not taught anything about melatonin in med school.
So I was quite panicked. So we called poison control and they're like, no, just let him sleep it off. And he slept it
Yeah.
off, woke up. There was not a thing. His heart rate was fine. His blood pressure was fine. Everything was fine. And so, you're right. It's irritating to test, although a lot of times I have to say to patients, just suck it up. You need the information, so get it done.
Yeah.
However, we don't routinely test melatonin levels. You're accurate in saying that. Not because of the irritation factor or even the cost, but we're all exposed to light. And if this person has really bad sleep hygiene, works shifts, does all of these things, I'll say, you can't overdose on melatonin, so try it. And on the days that you're working nights, make sure you take it, and not take it when you start your night shift, of course.
Yeah.
Take it on your way home, so that when you get home, your melatonin levels are high enough that you will want to go to sleep and you'll sleep more efficiently. But it's for the antioxidant effect, and for the fact that it has been shown in many different studies that it impacts breast cancer breast health, right? And so it lowers your risk for breast cancer when you have optimal melatonin levels. So, on the nights that I work on call, I'll take extra.
Mhm.
If I'm good and I'm not watching anything on a screen or device for a few hours before bed, I'll take much less. And people always ask for the dose. Traditionally it would be between 3 and 21 milligrams as the dose, and then you play around and find your dose. And that's what I say to patients, just start with 1 or 2 or 3. And then there's sublingual, which goes under the tongue, more immediate effect, within 30 to 60 minutes. And then there's the prolonged release, which sustains a release over time through the night. So melatonin.
Another thing, Natasha, we actually did record a video quite a few years ago about supplement quality, because you and I, we get this very often. So they tested a bunch of melatonin supplements. This was a study from Canada. And these are the like regular melatonin. So some of them said 5 milligram, they contained like 400% more. Some of them, whatever they said, they contained about 83% less. And looking at the bottle, that's the reason I tell my patients, don't send me links to this supplement and that supplement. I have no idea if we are not using that in our practice, because we are very particular about what supplements, we recommend. And Dr. Iyer has said that so many times. So be careful of the quality. There is no way to know looking at the bottle what the quality is like.
And that's exactly right. So there is no regulation on supplements, and that's why there's so much in talk about whether we should allow supplements, ban them, whatever, from a government and regulatory body level. But we restrict ourselves to recommending things from companies that make pharmaceutical grade products. It means there's third-party testing. It means that at any point in time, they're assuring you that your 150 milligrams of DIM is always 150 milligrams in this bottle, the next bottle, your 15th bottle, it's all going to be the same and not varying in potency and quantity. So that being said, you brought up this this topic on supplements versus herbals. Now, a herbal type of thing might be ashwagandha or ginseng or rhodiola. Do we recommend them? I recommend them all the time.
Yeah.
Because historically, and you and I were having that discussion with Dr. Keen the other day about being open to alternative things.
Yeah.
Because there's not always a study. And we were talking about sound bathing and Ayurveda and Chinese medicine and all of these things. So, as much as we love the science, there is no, I mean, there have been studies where, for example, rhodiola and different things have been studied in Russia in athletes to measure their performance, and they look at their cortisol and levels like that. And so they've been using adaptogenic herbs for performance. And so we do have data that you can extrapolate that these things actually make a difference. How I explain adaptogens to patients is it helps your body make more of what it needs and less of what it doesn't need. And I have no idea how it does that, but it does. Right?
Yeah,
Then
so
I
there are a
say
whole lot of, I mean, I don't want to
doctor,
get into the science because that's not always relevant for
yes,
everyone.
but there
They
is
do
a role.
work at the receptor level and a whole lot of things. Yeah.
But there is a role for supplement. So supplement,
Herbs.
I like to think of it as supplementing what your body should be
Yeah.
getting, right?
Yeah.
So when we said supplements, then magnesium, you should be getting it. And I just want to talk about magnesium and its role as you wouldn't specifically say magnesium helps you not get breast cancer. But
No.
magnesium, when deficient, you are constipated. Magnesium has more than 400 enzyme functions. So the enzymes needed to convert other pathways in your body. If you're short on magnesium, it's not going to work efficiently. So
Another big one is blood glucose regulation. We talked about the last time. Magnesium is
and so
very important.
magnesium and insulin sensitivity. So, and then there's an herbal we use all the time for insulin resistance called berberine. Right? It's not a nutrient, so it's not a supplement, it's a herbal formula. And so berberine is something we love for anybody who has insulin resistance. And then there's so many other things it does, right? So it does get confusing when you're trying to ask us, what are the best supplements? My budget is small, I can only afford this and this and this. I cannot take everything you talk about. And so then we have to go with priorities. But I would always say spend your money on something that is going to work. Otherwise, you're flushing it literally and figuratively, you're flushing it in the toilet, right? So, is vitamin D more important than DIM? I would say so.
Yes.
So if I had to pick between those two, I would pick vitamin D. If I had to pick between calcium D-glucarate and melatonin, well, sleep affects so many other things in your body. And when you are sleep deprived, your entire health suffers. So maybe you might not get breast cancer, but you could get a heart attack earlier because
Or dementia.
or dementia or depression or whatever it is that sleep affects, but it also affects your immune system. So if I had to pick between those two things, then I'd say go limit your endocrine disrupting chemicals, but take melatonin because you're a shift worker, because you're working late at night, or whatever the case may be, because sleep trumps that. And that's why it's called, you used to say customized, and then you would say personalized, right? So all the P's, the prevention, the personalizing, and the prevention of medicine that we practice. So, we're giving you general advice. We want you to know these things so that you can improve your overall health and your quality of life, and so that the life you live is filled with good quality years, not, your health span and then your lifespan spent the rest of it in a nursing home or in palliative care or wherever. We want to give you health span from start to finish. So we hope that this information has been very useful for you, and that you understand now about insulin resistance and how it impacts you, people always want to take supplements before they change their lifestyle. That's a typical thing we see,
I
right?
know.
Give me a pill. No, I can't just give you a pill. You still have to focus on your sleep hygiene. You still have to lower your body burden of toxins. Yes, I can give you the optimizer and the Cell Deep Clean to help remove some toxins and some glutathione. That's my favorite 3 in a cocktail, right? The optimizer, Cell Deep Clean, and glutathione, so that you can help your body eliminate and excrete as many of these toxins that we talked about, or endocrine disrupting chemicals that we talked about. But lifestyle, right? Diet, sleep.
Food style, Natasha. I love that word that
Style.
you use.
I call it food style. And for me, food style means a combination of what you eat and how you live your life. And it's a food style.
Yeah, food is in context to everything else. It's like,
Exactly. And it's
and
a
I
very
love
emotional thing.
how you prioritized like supplements versus herbs. That's really, I think it helps patients decide that, because they read, they get, these whole lot of ads, which like, oh God, so it is very confusing for a lot of people that which ones are the ones I should prioritize. So what you said is really like fantastic. Vitamin D over anything else because it has so many different functions. And today I didn't get to talk about one of my other favorites, omega-3 fatty acids. We'll leave that for another time.
Okay, we're telepathic because I was just thinking we have like a minute left, and should I ask you about the fatty acids, because they're essential. You can't make it, you have to get it from food, and no one eats enough food to get it.
And flax seeds are not going to give them.
That's exactly right. Although flax seeds are on my hormone pathway right here, Dr. Carr.
Yep.
This thing that we
Yes.
talk to patients about with estrogens and metabolites and all of
Yeah.
that. Flaxseed does help with estrogen metabolism and
But
balance.
yeah, but not for omega-3s.
Not for the omega-3s. All vegetarian sources, the maximum omega-3 you can convert using your body's enzymes, if they're working and if you have them, is 11%.
Mhm.
11% only. So it's a nothing dose when you need how much? 2 to 3 or
Depends.
even 4,000
Yeah. Depends
milligrams.
on what condition you're looking at. We'll dive into omega-3 some other day.
Right, but omega-3s is your immune system.
Yes.
This particular case, even though they're so crucial for your brain health and your bone and your heart and everything
And you
else.
can measure omega-3 levels. That's very important because for a lot of nutrients, we are not always like this test doesn't cost an arm and a leg. So I recommend that to everyone. And the reason, just a few weeks ago, I'll just share a personal story. I have been taking a relatively high dose. So my dose is about 3,000 milligram of EPA DHA combination. And it's 2 capsules. So it's like, the number of pills keep on increasing, more supplements we have. And we do get pill fatigue too. It's not just, our patients.
Yeah.
So I said, okay, let me measure my omega-3 levels because I haven't done it in a while. And it was just 8%. So it's not like, despite taking a higher dose, my levels had not gone up to beyond 12% or something. I want it to be between 8 and 10. So it's not reached 10 yet. And I'm very diligent about my supplements. So my point is, many of you are probably taking an omega-3 or you think you don't need because you eat fish every day. Get your levels tested. You may be in for a shock.
Yeah, that would be a thing worthy of surprise in the title. But that being said,
Yeah.
thank you for joining us. And this was lovely. I hope this is very useful information to all of you. You can access consultations with Dr. Carr and I through the clinic, Live Younger. And we would love to be able to have you at one of our live workshops and events and at future webinars.
Yeah. Thank you and bye.
Bye
Thanks,
now.
Natasha.